Imagine if I told you that Botox, the same injectable used to smooth facial wrinkles, might actually help men with stubborn erectile dysfunction who haven't had success with other treatments. I'm Dr. Reena Malik, a urologist and pelvic surgeon. And I know this sounds surprising, but recent scientific findings over the past few years have revealed some striking results that challenge what we previously believed about treating hard-to-resolve. Let me be absolutely clear. This approach is not FDA approved and it's not part of current treatment guidelines, but the research is compelling enough that it's worth understanding. So today, let's break down how Botox might improve erectile function, look at the actual results from clinical trials, and talk about which patients could realistically benefit. First, a little background on how erections work. If you've followed my content, you might remember the classic phrase, point and shoot. Point refers to erection that's controlled by the parasympathetic nervous system. Shoot refers to eject, managed by the sympathetic nervous system. Botox works by dampening activity in the sympathetic nervous system. It essentially blocks the release of norepinephrine, chemical messenger that tightens smooth muscle tissue, including the tissue in the penis. Think of the sympathetic nervous system as your body's emergency. If you're running from danger, your nervous system isn't prioritizing sexual arousal or erection. Even everyday conditions like high blood pressure, diabetes, and cardiovascular issues can activate this stress response, keeping the smooth muscle of the penis constricted. And if that smooth muscle doesn't relax, blood can't properly enter and build pressure, meaning no reliable erection. Botox essentially tells that overactive stress system to take a step back, allowing smooth muscle to relax, vessels to widen, and blood to flow in more effectively. It helps to compare it to its cosmetic use. Botox relaxes facial muscles to soften wrinkles. When applied to penile smooth muscle, it has a similar muscle relaxing effect, reducing tension, so blood can fill the erectile tissue more efficiently. The most common cause of erectile dysfunction is vascular. Either not enough blood flows in, or the blood escapes too quickly. Botox seems to target that exact issue now. The big question, does it work in real patients? Early research involved small but high-quality randomized controlled trials, the strongest type of medical study where one group received Botox injections into the erectile tissue, while the other group received placebo injections, saline. These participants had already failed oral medications like Viagra or Cialis, sildenafil or Tada, and even intracavernosal injections hadn't helped them. After 4 weeks, the men who received Botox showed noticeable improvement, not just in how firm their erections were, but in their overall erectile performance. Basically, these men, many of whom had stopped responding to any treatment and were even considering getting surgical penile implants, began seeing stronger, more reliable erections. Researchers then wanted to find out whether dosage mattered, so they ran a larger study with 176 participants and compared to amounts, 50 units of Botox and 100 units. Here's what they learned. Both dosage groups showed clear improvement in erectile function at the 3-month mark following the injection. Participants showed meaningful gains on the International Index of Erectile Function, the standard research tool for tracking changes in sexual performance. However, by 6 months, the improvements in the 50-unit group had begun fading back toward their original levels, while the 100-unit group still maintained their benefits. This tells us something important. Just like Botox used in other treatments, its effect gradually wears off, but a larger dose seems to extend how long the benefit lasts. On average, men requested another injection after about 9 months, which matches what I typically observe when I use Botox for overactive bladder, typically between 6 and 9 months. The strongest evidence came from a double placebo-controlled study published in 2020, meaning neither the patients nor the doctors knew whether the injections were Botox or placebo. This trial followed 70 men with erectile dysfunction who hadn't responded to oral medications. The researchers tracked multiple measures: erection firmness, blood flow by ultrasound, validated sexual function surveys, and after just 2 weeks, the Botox group showed measurable improvement over placebo. Their sexual health inventory for men scores improved by about 5 points on average. And here's the striking part. 53% of the participants who received Botox achieved erections firm enough for sexual intercourse, compared to only 3% in the placebo group. The improvements persisted for about 12 weeks. One note, though, this particular study is still only available as an abstract, and I'm waiting on the full peer-reviewed publication, but I'm familiar with the research group behind it. This was a strong, well-conducted study, and the results looked genuinely encouraging. But a newer multi-center trial from 2025 just released its data, and in that broader analysis, they didn't find a meaningful improvement when men took Viagra along with incobotulinumtoxinA, better known by the brand name Z. However, when they narrowed the data specifically to the men who consistently took Viagra as prescribed and got the Botox injection, those men did experience a notable benefit. This suggests some kind of synergy where both treatments working together might be necessary. Most of the earlier research happens in rigid, tightly controlled clinical environments, but real life isn't always so tidy. So in 2023, researchers ran a real-world observational study examining 216 men who received Botox as a treatment for erectile dysfunction. Out of that group, 92 men, about 43%, returned for a second treatment, which strongly implies they felt the first injection worked well enough to repeat. And the average time before they came back was around 9 months. From my own experience, after seeing the early data, I began offering Botox to patients who were interested, while making it clear this is still not guaranteed to help every man and also not covered by insurance at this point. And although my patient population isn't representative of the world at large, more than 90% of mine have come back for a second treatment, and some have returned for a third or even fourth. When researchers looked at responses by moderate or severe ED, the outcomes were interesting. Among men who started with mild erectile dysfunction, 90% experienced a substantial improvement. And substantial, of course, is defined relative to how severe the dysfunction was in the first place. To measure improvement, researchers rely on standardized questionnaires. For example, with mild ED, even a 2-point rise counts as meaningful progress, while with moderate ED, a 5-point increase is considered a significant improvement. These thresholds come from years of data on how men themselves perceive real, noticeable change. With moderate erectile dysfunction, around 50 to 55% of men showed improvement, while among those with severe ED, the response rate was lower, around 33%. But keep in mind, these men had already failed multiple other treatments like oral medications, penile injections, and were often on the brink of considering surgery. Interestingly, when men with severe ED combined Botox with oral ED meds or even intracavernosal injections, the success rate climbed to around 50 to 60%. So again, combination treatment appears to work better than Botox alone. They also discovered certain groups responded poorly. Men who had ED due to nerve-related causes such as after prostate cancer, surgery, or spinal cord injury didn't see much improvement. Another piece of evidence came from a systematic review and meta-analysis that pooled data from several studies. It found that about 77.5% of men who returned for multiple rounds of Botox injections experienced significant benefits. They also compared different brands Botox, Dysport, and Zuhimmin and found no meaningful difference in effectiveness between them. Of course, the key question is safety. Fortunately, the safety record in all these studies is excellent. The most frequent side effect, and really the only notable one, needs discomfort at the injection site. In practical terms, here's how it works in my clinical setting. We apply a numbing cream to the penis, then administer for small injections directly into the tissue. Even with numbing, most men feel a brief sting or pressure during injection, but it's short-lived, and the discomfort fades quickly. The only part of the procedure that most people find inconvenient is the constriction band we place at the base of the penis. During the injections and for about 20 minutes afterward, this is simply to keep the Botox from entering the bloodstream. I've personally never seen this happen, and there hasn't been a documented case of systemic absorption in the research, but we use the band just to be extra cautious. Lasting pain after the injection is extremely uncommon. The one complication doctors genuinely worry about is priapism, an erection that continues more than 4 hours, is painful, and happens without sexual stimulation. Some men jokingly think that sounds like a dream scenario, but in reality, it's dangerous. When blood stops circulating in the penis, after a few hours the tissue begins to change, and eventually the body starts forming scar tissue. That damage can be permanent. So if anyone ever experiences a prolonged erection like that, it's critical to go immediately to the emergency room. We keep an eye on this risk with Botox because the medication causes the muscles to relax, and those muscles need to contract properly for blood to exit the penis. The good news, across hundreds of treated individuals, there has only been a single documented case of priapism. Otherwise, there have been no major complications, no systemic side effects, no permanent damage. And this brings us to the bigger picture, the risk versus benefit conversation. I want to emphasize again this. Treatment is not FDA approved, not part of the official American Urological Association recommendations, and not covered by insurance. Much of the published research comes from European studies, particularly out of France, and in the US, it's still considered experimental, of course. The research is still evolving. Most study participants were tracked for about 6 weeks to 7 months, so long-term data is limited. But we do know Botox eventually wears off, which suggests long-term risks may be minimal. Still, the studies so far have been relatively small, with the largest trial involving around 176 people, we still need more clarity on the ideal dose, the best injection method, the ideal patient profile, and whether benefits persist over many years of repeated treatments. So, who's actually a good fit for this treatment based on what we know so far? If you've already tried the standard pills, like Viagra or COLs, with no sex and even penile injections didn't work and your erectile dysfunction is caused by blood flow issues, rather than nerve damage from surgery or injury, then you might be someone who could potentially benefit. This can also be something to consider before moving forward with the penile implant. Just keep in mind, this isn't a permanent fix after one session. You'll likely need follow-up injections roughly every 6 to 9 months to keep the results going. One interesting side note that came up in some studies is that, because Botox relaxes the smooth muscle in the penis, the flaccid length appeared slightly longer in some men. It creates a more relaxed state, which can make it appear more extended, but I don't promote this as a proven method for increasing size because it's still not backed by strong long-term evidence. The takeaway is this: Botox as a treatment for erectile dysfunction looks promising. Depending on the severity of the condition and whether you combine Botox with other therapies, the response rates have ranged from about 40% to over 70%. The mechanism behind it makes sense. It reduces that overactive stress response and improves blood flow by relaxing the vascular smooth muscle. And overall, it appears very safe with minimal effects reported still. It's important to stress that this treatment is experimental. It isn't FDA approved. It's not part of the official urology guidelines in the United States, and most doctors aren't offering it yet. But if you've exhausted every other option and are on the verge of choosing a penile implant, this may be worth talking about with your urologist or considering in the context of a clinical trial, which is always the ideal if accessible. And lastly, if you've been enjoying this information and you've watched a few of my videos but haven't hit subscribe yet, I'd really appreciate it if you did. It doesn't cost a thing. It genuinely helps the channel, and it signals to YouTube that this content matters and should be shared with more people. My goal here is to help you feel informed about your body, confident in your choices, and better prepared when you step into a doctor's office.